Surgery is surgery, and anytime you sign that informed consent, first thing when I get my patients to sign it, risk of infection, bleeding, damage to other organs, and at the bottom, death, right? It's an inherent risk. Surgery has risks. So whether you are getting a hysterectomy, a BBL, bariatric surgery, breast augmentation, sure, the overall probability of survival and everything turning out good is very high, but there's still a legitimate, very real risk that it can go very bad. So I think this may have just been an infection that just went
What do you
wrong
think,
very
Chris?
quickly.
Well, I think it could be fake and it could be real.
You got to
And
pick
for
one.
that
No
reason,
capitulating.
I'm going to pick one. I'm going to say it's messy.
Okay.
Okay.
Because we don't have the details
information,
of what
right.
happened.
Okay, we're
But we do
speculating
know,
here.
and Professor Nick is going to tell us about what are the risks of BBL, and fat embolism is one of them. So just educate us.
First, let's just talk about Mark's speculation.
Yes.
I don't highly unlikely to die from an infection a day after surgery. Like it takes time to develop an infection. I don't care what type of surgery you have, unless they're using instruments that are completely contaminated, full of feces or something. No one would. I wouldn't think that someone died from an infection the day after surgery. Now, with a BBL, there are some complications that are more inherent to the procedure, and mortality specifically, fat embolism. So basically what happens is when you're transferring the fat into the buttocks, all of the blood vessels are underneath or below the muscle, the gluteal muscles. So if you rupture or injure one of those vessels, specifically the gluteal veins, fat can go into the vein, go into your vena cava, end up in your lungs, and is fatal. And so if that was the case, I would have suspected that to happen intraoperatively. But the fact that she went not home, but I'm assuming it was
She was
overnight,
recovery house.
a recovery house
Okay.
or something of the sort, and she died there, it was probably something else, maybe like a pulmonary embolism, which is also similar to fat embolism, but basically there's a blood clot typically in one of your large veins in your legs, and it goes into your lungs, and again, poor oxygenation, you end up dying.
But it sounds like she had a
Just a
brain
headache.
herniation, like she had a headache.
yeah,
So
but-
and then just became unresponsive. That sounds like
Yeah, but headaches you can have a headache from anything. You can have a headache from acute blood loss.
right, but they're saying the
But did you
reports are
say
saying
she had
that her
bleeding internal?
no, they said her torso had bleeding, probably from where they took the fat.
Mm-hmm.
But the reports are that her brain was swelling. So like somewhat when brain swells, it can no longer fit in the skull, so it starts herniating down.
Right.
The,
But could that be
the
like a
brainstem.
fluid imbalance, like you all like can
Yeah, could that happen?
that their
could
sodium
cause-
level
yeah.
got off and then they
What could cause
Let's say there was herniation.
too much
What?
fluid from the lipo?
Yes. Could
Isn't that something where you put too much fluid in and then their brain swell or something?
that would be highly unlikely.
Okay.
The things that come immediately to my mind, PE, fat embolism, assuming that she's completely healthy.
Right.
And then bleeding. I mean, anytime you have surgery, you have a risk for bleeding. If you have a BBL, you have to suction out fat. So where do you take the fat from? Your abdomen, flanks, your back. And if they have someone loses a substantial amount of blood, I mean, yeah, they can die.
People don't talk about the risk of BBL. Number one, it's one of the most popular operations
Right.
that we do now. But
give us some stats.
yeah,
like
give us
for
some
every
statistics.
100,000 BBLs,
'cause
I
I
don't know if
read-
there's that
I-
many being done, but
He
No,
said
so-
his stats are good.
Because I read a major, the Plastic Surgery Society actually announced about the risk of the
Right.
fat embolism. Just talk about that a little.
Yeah, so when this procedure became popularized, I would say maybe it was like 10 years ago. When it became popularized, they were actually putting the fat under the muscle. And the reason you put it under the muscle is because you get more projection that way. And so what was happening, they started to have these deaths. And then after investigating them, they realized that, hey, putting the fat under the muscle, that's unsafe. The Plastic Surgery Society came out with a recommendation that the fat should only be placed subcutaneously. And then in some places like Florida, where, it's high volume, so they charge really low prices, but
They
have
do
to
a lot of them.
Yeah. And so you have plastic surgeons, you have cosmetic surgeons, you have people who maybe aren't even surgeons doing this procedure, and they're just putting the fat in, and of course, you have a higher complication rate. And so the mortality was so high in Florida that the Board of Health stepped in, and now they've come up with all these guidelines, and I believe they can only do like
4.
4 a day. So that's really not addressing a problem. Now you can also use the ultrasound. You can do ultrasound guided BBL where you use an ultrasound to make sure that the cannula is in the subcutaneous space. So the safest way to do the surgery is to inject the fat subcutaneously.
Okay.
Thank you for that.
Thank you for that. In any event, my attending used to tell me if you don't have complications, unfortunately, you're not operating enough. And that's just medicine. I mean, surgery, you could do 1,000 cases. At some point, you're bound to have a complication. That's just medicine. That's just the nature of the beast. We wish everything could turn out perfect, but that's not always the case. There we go.
Perfect.
All right.